Bird Flu's New Frontier, Navigating the Spread to Dairy Cattle. In this episode, we explore the recent transmission of H5N1 avian influenza to dairy herds across multiple U.S. states. We discuss the implications for the agricultural industry, food safety concerns, testing challenges, and the measures being implemented to protect public health. The recent spread of highly pathogenic avian influenza, HPAI, H5N1, commonly known as bird flu, to dairy cattle across multiple U.S. states marks a significant and unprecedented development in the ongoing outbreak. This cross-species transmission poses new challenges for both the agricultural sector and public health authorities. Spread to dairy herds. As of March 2024, H5N1 has been detected in dairy herds across 16 states, affecting approximately 845 herds. This represents the first known transmission of the virus from avian species to cattle. The outbreak, which began in January 2022, has already led to the culling of approximately 123 million birds in efforts to contain the virus. Impact on food supply and safety. The detection of H5N1 in dairy cattle has raised concerns about food safety. For instance, California's Raw Farm was shut down, and its products were recalled after milk samples tested positive for bird flu, although no human cases have been linked to these products. Health officials emphasize that pasteurization effectively inactivates the virus, rendering pasteurized dairy products safe for consumption. However, raw milk poses a potential risk, leading to increased testing and regulatory scrutiny, testing protocols and false positives. The implementation of new PCR testing protocols for detecting H5N1 in raw milk involves high cycle thresholds, which may increase the likelihood of false positive results. This has raised concerns among producers and consumers about the accuracy of testing methods and their implications for agriculture and food safety. Public health considerations. While human infections with H5N1 remain rare, the virus's presence in dairy cattle necessitates vigilant monitoring. Individuals in close contact with infected animals, such as farm workers, are at a higher risk and should adhere to recommended biosecurity measures to prevent potential transmission. Conclusion. The extension of the H5N1 outbreak to dairy cattle underscores the need for enhanced biosecurity measures, accurate testing protocols, and public awareness to safeguard both animal and human health. Continued collaboration among agricultural, public health, and regulatory agencies is essential to effectively manage and mitigate the impact of this evolving situation. Disclaimer: this podcast is for informational purposes only and does not substitute professional medical or veterinary advice. Individuals involved in livestock farming should consult with relevant authorities for guidance on biosecurity and disease management practices.